All right, team. Well, this is a new adventure for me. Doing video stuff's not something that I've done in the past. It's at least not like this. I've had it to where people have interviewed me and done different things like that for different spotlight videos that we have, but this is new and different. But we're in an ever-changing world, and a lot of our staff, I don't get to interact with on a daily basis. And I think one of the things that's important in leadership and business is to know direction, to try and understand the vision. So a lot of you have received new direction from your skills coach leaders about different spreadsheets and different things that they're asking you to fill out. A lot of that stuff's come from me directly. We're changing the way that we practice. We're changing the scope of things that we do, and we're getting larger in what we do. Those spreadsheets are going to be vital in us moving forward with total health. I can't iterate that enough. I'm trying to connect with doctors, other organizations, so that we can eventually get to a place where we're embedding skills coach leaders in actual doctor's offices where we can provide co-occurring treatment, both mental health and physical health. And this is the direction we're going. And it's something, to be honest, that Bowen has done a very good job with, embedding staff in other locations to achieve better outcomes. The majority of you, one of your favorite places to work and work with your clients, your patients, is in the school. One of the reasons that is because you're able to see immediate outcomes. There's structure there, and it provides a safe place for you to work with that client. We're going to do some of the similar stuff with doctors' offices. We're simply learning, and I think it's something that we've known for a long time, is that physical and emotional health, mental health, they're all correlated. They're interlocked, and they cause our patients a lot of pain. If you think about even something simple as high blood pressure, a lot of times a doctor is going to prescribe medication for that high blood pressure, but that's not the only thing he does for that patient. He may tell that patient, I need you to exercise regularly so that we can get your blood pressure under control. Well, now a physical health doctor, someone who doesn't do behavior change, is asking that client to change their behavior, and that's all they're simply doing. They're not putting together any type of plan. They haven't really, they've put the goal out there, but they haven't made it incremental. I can't even say that word. They haven't made it to where they can attain the goal. It's not small. It's not achievable. It's not in increments. There we go. I got it. And that's what we do. And mental health and behavioral health, emotional health, we make things smaller. We work with clients on a level and on a more regular basis so that we can see that change in their lives. And that's what this is. That's what this move to total health is. I believe you've also received an email from me within the last couple of weeks just talking about our proposal for total health. So I want to give a little bit of update on that and some good news. I mentioned that we are one of the offices that have been selected to do a in-person total health presentation with our executive team. And that simply just clarifies some of the questions that they have about our proposal. I learned that we are one of 5 offices. So every director had an opportunity in the center, was requested to do the same type of proposal that we did, or something different. They had to come up some way to address total health issues. And we are one of the locations that they're selecting to move on to the next phase. I didn't know how many offices had been selected, but recently found that out. Shannon Hannon, one of our vice presidents, has said within the recent past that they could do as many as 5 of these total health clinics if they have a motivated teams that are willing to really put forth the effort and achieve this goal. So you heard me say There's only 5 offices that are being interviewed in person for this opportunity, and Hannon thinks that we can do as many as 5. So the likelihood that we're moving to total health within the next year or 2 years is really good. And that's something I am extremely excited for, because I think this allows us to make dramatic change in our clients' lives. How many clients do you work with, or I've worked with in the past, that just get stuck and we can't figure out some of their behaviors? Wonder how awesome it would have been if we had physical health and mental health resources all working together to identify those problems, because maybe something that I was struggling with that client, that patient, was related to their physical health and I wasn't catching it. So it's extremely important to make this move. Now, one of the things that's going to be required, and one of the things that we're starting even before we get to total health, even if they don't put a doctor in our building, we're looking to make relationships, partnerships with doctors' offices. And that starts with you guys, with our frontline staff, our skills staff. Part of your job, and I think it's part, to be honest, that we have understated, is the coordination of care, to be involved in appointments, to be a point person for the client. Part of that is going to doctor's appointments. And I'm not saying taking clients to doctor's appointments. I'm literally saying going into the appointment with them, spending time listening to the doctor, getting that feedback, and also communicating things on behalf of the client. It's something like 8 out of 10 clients that go to the doctor don't understand. Sorry, I said clients. I really mean people. 8 out of 10 people go to the doctor and they don't understand that the message or what they were supposed to get from the doctor. So then they're leaving that appointment like, I don't know what to do. So we as professionals need to be intervening on behalf of our patients, making sure that we understand what the process is. And that's just something that we're going to have to do. Apologize, Sean's phone's ringing. So yeah. The other thing that I'm excited about for Total Health is this is going to create a lot of new opportunity within our organization. And with being one of the first offices to get to this kind of place, to being close to being ready for this, there's a lot of growth. You think about how many clients we're able to bring in just from schools and the growth that we've had. I mean, in 10 years that I've been here, we've grown from about 3 or 4 skills coaches to now we're knocking on the door of 30 skills coaches. And that was with 1 school district. And now as we're adding 3 school districts, doctors' offices, and we look at how we've grown, Syracuse has always been a place of tremendous growth. A lot of people will look at our office today, and if they look back and when they started, a lot of people will say, I never anticipated that this office would be this large. It's kind of been understated. Syracuse has been undersold. It's the stepchild of Kosciuszko County, when really Syracuse is moving forward. We're continuing to grow. We're continuing to prove people wrong. And a lot of that is because of the great work that you guys do. If we weren't providing a quality service, then we wouldn't be able to grow. We wouldn't be able to achieve goals. So I thank you for that. So yeah, I don't really know what else to say. I'm going to be doing these videos a couple different times, a little more training. But the message that I need for you to hear now is get those spreadsheets in, get them completed. And then I would also like you to start thinking about how can I work my clients' appointments into my schedule, especially if they have just lingering things like diabetes, if they have high blood pressure, arthritis, if it's a kid, they've got well child, or maybe they have asthma, different things that they need to make behavior change with. I would urge you to make sure that you're attending those appointments with them and getting that information. If you're a therapist and you're watching this, part of this is going to change for you too. Communication is going to be absolutely key. especially as we move to our new modes of therapy, ACT and FACT. And as you get trained on those, you're going to have to communicate with doctors a little bit more, because we're treating the whole person now, not just mental health, not just emotional health. They're our patient, and we want to make sure that they're achieving the goals that they need. So therapists, I would tell you to continue to reach out to doctors, find out different things that they're working on, communicate with the skills coaches on what the skills coaches have learned, and then looking and asking the client what physical health things are you working towards right now? Are there things that you're struggling with? Add them to the treatment plan so that we can move forward in this total health direction. If you're watching this video, this is you're going to get 15 minutes of trading credit. What I would like you to do is in the notes section or whatever, somehow communicate it to your skills coach leader or your direct supervisor. If you just put total health in an email to them, or I don't know if there's a comment box on the training report, you can put total health in that, and you're going to get 15 minutes of credit. I will ask that if you are watching this video not to share with anyone what the word is or the 2 words are for the training credit, because our staff are going to be watching that, and I want to make sure that they get the message from this video. All right, thanks. I appreciate you guys. I appreciate all you do and the impact that you make on our community. And once again, this is 15 minutes worth of training credit. Make sure you put in total health.